morning, ladies and gentlemen. I would like to welcome you. Today I'm going to talk about the importance of Aboriginal health. If you have any questions note down your questions and feel free to email them to me. And there will be a short summary at the end I would like you to fill out. Today I would like to talk about the following: how health impacts on learning, barriers to physical activity, multi-risk to health impact on Aboriginal attending school. Okay, let's get this presentation started. Health impacts. There is a higher portion of Aboriginal students are at a moderate or high risk of clinical, scientific, emotions or behaviour difficulties than non-Aboriginal children. Indigenous children experience chronic health problems such as middle ear infection and nutritionist deficiencies. These affect their school attendance and learning outcomes. Poor nutrition also has an impact on Indigenous children attending, as they are tired, underweight and prone to other illnesses. This is due to a lack of regular meals. Children that have poor nutrition severely limits the children's capacity to concentrate and learning at school. Barriers to physical health. Indigenous Australians are less physically active than the rest of the population. Due to less exercise, this increases their risk of developing health conditions such as obesity, diabetes and heart disease. The rate of this illness is high in the Indigenous Australian population. Some cultural barriers to exercise are attitudes to personal health. Importance of relationship is very important to Indigenous people to spend time with their family and their community. Doing exercise would mean they have less time to spend with their family. Other barriers are there are less sport facilities and health care services available to people living in remote areas. They experience racism twice as much than non-Indigenous people. Limited transport, which makes it difficult to attend. Physical education programs in school typically fail to accommodate Indigenous Australians, students by ignoring their cultural practices. Multi-risk to health. Due to limited physical activity, it is not only health risks that face Indigenous Australians. There is a higher rate of cigarette smoking, drinking more alcohol, more likely to be exposed to violence, more likely to be obese and eat a poor diet. Their diet is high in fat and salts and low in fresh fruit and vegetables. Common reasons are access to fruit and other fresh food for people living in remote areas. Storing and preparing fresh food is also difficult if the family lack access to a kitchen facility or electricity. Impact of health on Aboriginal attending school. Indigenous children miss a lot of school and have a poor attendance record due to a lack of reconciliation by schools of Indigenous cultures and history, and fail to fully engage parents, carers and the community. Ongoing disadvantages in many areas of the daily lives of Indigenous Australians. Indigenous Australians who regularly miss school are likely to experience scientifically disruption in their education. If they miss more than one full day per week on an average, they will lose 2 years of education over a 10-year period. My conclusion: what can we do to help Aboriginal children get access to facilities that would improve their health? We could have more access to facilities that would help them to physical activity. We also need to help Indigenous children understand they can exercise and also spend time with their family. We need to make fresh fruit and vegetables available for Indigenous people. We could do this by having someone take it out to the remote areas, help them make gardens where they live, and learn to prepare nutritious meals. Also, we need to try to help Indigenous people understand the importance of exercise and how it can improve their health, and how it can reduce their blood pressure, reduce the risk of heart attack, lower the risk of type 2 diabetes and some cancers. Also, it can lower the risk of falls. Schools need to be more healthy meals given to Indigenous Australians, such as when they get to school, give them breakfast and then lunch. We also need to encourage more Aboriginal children to attend. Thank you for viewing and participating in the presentation. Please forward via email any questions. I will respond as quickly as possible. Please complete the survey that has been emailed to you prior to listening to this presentation and email back. I hope this has helped to give some understanding of Aboriginal health in Australia.